autism and schizophrenia simplex, two conditions that share some overlapping traits but are fundamentally different. Both can involve social withdrawal, difficulties with communication, and rigid thinking. But while autism is a lifelong neurodevelopmental condition, schizophrenia simplex is a progressive psychiatric disorder that leads to a slow decline in mental functioning. What does that mean in practice? Let's break it down. The biggest difference between autism and schizophrenia simplex is how and when the symptoms appear. Autism is a neurodevelopmental disorder, meaning it is present from early childhood. Symptoms usually appear before the age of 3 and remain relatively stable throughout life. In contrast, schizophrenia simplex is a progressive psychiatric disorder that leads to a slow decline in mental function, typically beginning in late adolescence or early adulthood. Over time, individuals with schizophrenia simplex lose motivation, cognitive abilities, and social engagement. Both disorders involve social difficulties, but in very different ways. People with autism struggle with understanding social norms, nonverbal communication, and emotional expressions. They may prefer routines and structured interactions, and some may have limited or delayed speech development. However, they typically do not withdraw from social interaction out of disinterest, but rather because they find it challenging. Schizophrenia simplex, on the other hand, leads to a progressive loss of social interest. Unlike autism, where the individual may attempt structured social interactions, people with schizophrenia simplex become increasingly apathetic and emotionally detached, showing little motivation to maintain relationships. Cognitive difficulties exist in both disorders, but they manifest in different ways. People with autism often have rigid thinking patterns and deep repetitive interests. Their thinking is structured but sometimes overly concrete, meaning they may struggle with abstract concepts. Schizophrenia simplex, however, is characterized by a gradual cognitive decline. The person becomes increasingly disorganized in their thinking, loses motivation, and struggles to maintain attention or engage in problem solving. Unlike autism, where interests are highly focused and consistent, individuals with schizophrenia simplex gradually lose interest in almost everything. One of the biggest misconceptions is that autism and schizophrenia are both psychotic disorders, but they are not. Autistic individuals do not experience hallucinations or delusions. They may have sensory sensitivities or strong internal thoughts, but their perception of reality remains intact. Schizophrenia simplex, however, is a unique subtype of schizophrenia where classic symptoms like hallucinations and delusions are largely absent. Instead, it leads to a slow deterioration of emotional and cognitive function. The person becomes increasingly detached from life but does not necessarily experience false beliefs or sensory distortions. For autism, treatment focuses on behavioral support, social skills training, and speech therapy. There is no medication specifically for autism, but coexisting conditions like anxiety or ADHD may be treated with medication. For schizophrenia simplex, treatment involves long-term psychiatric care. While antipsychotic medication is often prescribed, it is less effective than in typical schizophrenia. Cognitive and social rehabilitation therapies are crucial to slow the decline in functioning and maintain independence. Autism and schizophrenia are different disorders, but did you know that childhood-onset schizophrenia can sometimes be mistaken for autism? In the next video, we'll explore how to tell them apart.